You know, there are few things that make a parent's heart stop faster than seeing your child take a really hard fall. And when they get up, crying, clutching their arm, you're immediately trying to figure out, is this just a bad bruise or is it something more? Today, we're going to walk through a common but definitely scary injury, a pediatric elbow dislocation. Our goal is to help you turn that moment of sheer panic into a clear, confident plan.
So here's our game plan. We'll start with the signs to look for right after that fall. Then we'll walk you through what to expect at the hospital. We'll cover exactly how it's treated, what the road to recovery looks like, and finally, we'll touch on any potential complications to keep an eye on as your little one heals up.
Okay, so let's set the scene. Your child falls, maybe off the monkey bars or a bike, usually right onto an outstretched arm. It's that classic playground scenario. The tears are a given, right? But your job now is to channel your inner detective and look past the crying to see what's really going on.
And this is the million-dollar question. How do you know? What are the specific clues that tell you, okay, this is more than a bump, we need to head to the emergency room right now?
Well, the signs are actually pretty clear if you know what you're looking for. First, just look at the elbow. Does it look wrong, kind of misshapen or out of place? Is it swelling up really fast? And here's the big one. Your child will absolutely, positively refuse to move or bend that arm. They'll guard it so fiercely that it might just hang there, looking limp, a sign doctors actually call pseudoparalysis. Those are your red flags.
So what's actually happened inside? Simply put, the bones that meet at the elbow have been knocked apart. It's like a train that's jumped off its tracks. This is a significant injury, and getting those bones put back where they belong is a job for a medical professional, and you want to get it done pretty quickly.
All right, you made the right call and you're at the hospital. Just knowing what to expect in the ER can take so much of the stress out of the situation, not just for you, but for your child too.
After a very gentle exam, the first thing they're going to do is get an X-ray. Now, this isn't just to prove it's dislocated. That's often pretty obvious. The X-ray is like a detailed map of the injury. It confirms everything, shows exactly which way the bones have shifted, and, this is really crucial, it checks for any other damage. And here's why that X-ray is such a big deal. The force it takes to pop an elbow out of place is often strong enough to chip off a piece of bone at the same time. And finding one of these associated fractures, especially on that bony bump on the inside of the elbow, is so important because it can totally change the treatment plan.
Now, one thing the doctors will also do is differentiate a true dislocation from something called nursemaid's elbow. This is super common in toddlers. While the arm might look similar, just hanging there limply, nursemaid's elbow is much less severe. It's often caused by a simple pull on the arm, and the X-ray will look totally normal. A true dislocation from a fall, on the other hand, will have that obvious deformity and swelling.
Okay, the diagnosis is confirmed. It's a dislocation. Now, the entire focus shifts to the solution, getting that joint back where it belongs, safely and comfortably for your child.
The standard treatment has a fancy medical name, closed reduction, but it's actually pretty simple. Closed just means no surgery, no cutting. And reduction is the term for putting the bones back in place. Your child will be given sedation, not just for pain, but to really relax all the muscles around the joint. This makes the whole process much smoother and gentler. I think it's really important for parents to know this is not about brute force. It's a very controlled, precise maneuver. While your child is comfortably asleep, the doctor applies gentle, steady pulling, or traction, to the arm, and then carefully guides the bones back into place. You might even hear a little clunk as the joint pops back in. Then they'll take one more X-ray just to confirm everything is perfectly aligned.
Now, in most cases, that closed reduction works like a charm. But what if it doesn't? What happens if something is physically blocking the joint from going back in?
This happens in about 1 out of every 10 cases. Either a piece of soft tissue or one of those little bone chips we talked about gets wedged in the joint, pretty much acting like a doorstop. And when that happens, it's called an irreducible dislocation. And it just means they need a different game plan.
So if a closed reduction doesn't work, the solution is an open reduction. This just means it's a surgical procedure. The doctor makes an incision so they can look directly into the joint, clear out whatever is blocking it, and then perfectly realign the bones. A lot of the time they'll use some temporary pins just to hold everything nice and secure while it heals.
All right, the joint is back in place. Whew! The hardest part is officially over. Now we're on the road to recovery. This part is all about protecting that healing joint and then slowly, gradually getting its movement and strength back.
So what do the next few weeks look like? Well, recovery follows a pretty predictable path. For about the first 3 weeks, the arm will be safe and sound in a splint or a cast. Right around week 4, that comes off, and it's time to start some gentle motion exercises. Then, usually by week 6 or so, most kids get the green light to gradually get back to all their normal activities in sports.
And this brings us to a really critical point. After an injury like this, the biggest enemy is stiffness. That's why starting gentle movement as soon as the doctor says it's safe is so important. Often you'll work with a physical therapist who can guide you and your child through the right exercises to get that elbow moving smoothly again. Finally, let's talk about potential issues. Now, it's important to be aware of what could happen, but it's just as important to know that serious complications are pretty rare, and the overall outlook here is fantastic. So let's start with the most important message right up front. Kids recover incredibly well from this. With fast, proper treatment, the huge majority of children get back the full use of their elbow with no lasting problems at all.
So the most common thing your doctor will be keeping an eye on is that stiffness we mentioned, and that almost always gets better with therapy. Much less common are things like a temporary nerve irritation from the injury itself, or the elbow becoming unstable again. And having the bone heal improperly, that's really rare when the treatment is done right.
And at the end of the day, this is why the outlook is so good. A child's body is basically a healing machine. Their bones have this amazing built-in ability to heal themselves and even reshape or remodel as they grow. That natural superpower is truly on your side here. And this all brings it back to you, the parent. Your role in this is absolutely vital. Getting your child to the doctor quickly and then really sticking to that rehab plan, those are the 2 keys that unlock a full, successful recovery. So, what's the bottom line? An elbow dislocation is, without a doubt, a scary and painful thing to go through. But the human body, especially a kid's body, is just unbelievably resilient. With the right care and a little bit of time, that scary fall just becomes another story you'll tell. Thanks for joining us.